Hello and good day, welcome to our YouTube channel, God's Promises. And today's video will be the subject. Understanding high blood pressure, can 140/90 be normal? Are doctors wrong? Understanding high blood pressure, debunking the misconception and exploring medical perspectives. High blood pressure, or hypertension, is a significant health concern affecting a substantial portion of the global population. It is essential to have accurate information about blood pressure readings and to understand the perspectives of medical professionals. In this video, we will delve into the concept of normal blood pressure ranges, address common misconceptions, and shed light on the medical community's approach to this condition. The definition of blood pressure. Blood pressure is typically measured using two numbers, systolic pressure and diastolic pressure. The systolic pressure represents the force exerted on the artery walls when the heart contracts, while the diastolic pressure reflects the pressure when the heart is at rest between beats. Blood pressure is measured in millimeters of mercury, mmHg, and is expressed as systolic/diastolic. For many years, a blood pressure reading of 140/90 millimeters of mercury has been widely used as the threshold for diagnosing hypertension. However, it is important to note that medical perspectives and guidelines on blood pressure have evolved over time based on scientific research and clinical evidence. Normal blood pressure ranges. According to current medical guidelines, a blood pressure reading below 140/90 millimeters of mercury is generally considered within the normal range for most adults. However, it is crucial to recognize that blood pressure can vary depending on several factors, including age, overall health, and individual circumstances. It is advisable to consult with medical professionals who can evaluate your specific situation and provide personalized recommendations. Debunking misconceptions. Misconception: blood pressure of 140/90 millimeters of mercury is normal. Some individuals believe that a blood pressure reading of 140/90 millimeters of mercury is entirely normal and does not require medical attention or intervention. However, this misconception fails to acknowledge the potential risks associated with blood pressure in this range. Reality: optimal blood pressure is below 140/90 millimeters of mercury. Current medical guidelines aim to maintain blood pressure levels below 140/90 millimeters of mercury for most adults. It is crucial to understand that lower blood pressure levels within this range are associated with a reduced risk of cardiovascular complications. The importance of medical professionals. Diagnosing and managing high blood pressure should not be solely based on personal beliefs or assumptions. Medical professionals, including doctors and healthcare specialists, possess the knowledge and expertise necessary to accurately assess blood pressure levels, evaluate overall health, and develop appropriate treatment plans tailored to individual needs. Consulting with medical professionals is vital for accurate diagnosis, effective management, and monitoring of high blood pressure. They can provide guidance on lifestyle modifications, prescribe medications when necessary, and regularly monitor blood pressure to ensure optimal health. Understanding common side effects of blood pressure medications. Blood pressure medications, also known as antihypertensive drugs, are commonly prescribed to individuals with high blood pressure, hypertension, to help manage and control their condition. While these medications are generally safe and effective, it is important to be aware of the potential side effects they may cause. In this article, we will discuss some of the common side effects associated with blood pressure medications. Common side effects of blood pressure medications. Dizziness. Some individuals may experience dizziness or lightheadedness, especially when standing up quickly. This can occur due to the medication's effect on blood pressure regulation. Fatigue. Feeling tired or experiencing a lack of energy is a common side effect reported by some people taking blood pressure medications. It is important to note that fatigue can also be caused by the underlying condition itself. Headaches. Headaches can occur as a result of the medication's impact on blood vessels and blood flow. However, not everyone experiences headaches while taking blood pressure medications. Nausea. Some individuals may experience nausea or an upset stomach as a side effect of certain blood pressure medications. Taking the medication with food or adjusting the dosage timing can sometimes help alleviate this symptom. Dry cough. A persistent, dry cough can be a side effect of specific types of blood pressure medications, such as ACE inhibitors. If the cough becomes bothersome, it is advisable to consult with a healthcare professional for potential alternative medications. Edema, or swelling in the legs, ankles, or feet can occur due to fluid retention caused by certain blood pressure medications. Monitoring fluid intake and discussing any significant swelling with a healthcare professional is recommended. Sexual dysfunction. Some blood pressure medications can potentially lead to sexual side effects, such as erectile dysfunction in men or a decrease in libido. If these effects are significant and impact quality of life, it is important to discuss them with a healthcare professional. Managing side effects. It is crucial to remember that not everyone experiences side effects, and the severity can vary from person to person. If you are prescribed blood pressure medication and are concerned about potential side effects, it is important to discuss your concerns with a healthcare professional. They can provide guidance on managing side effects, adjusting the dosage, or exploring alternative medications, if necessary. While blood pressure medications are effective in controlling hypertension, it is important to be aware of potential side effects. Monitoring your response to the medication and promptly reporting any concerning symptoms to your healthcare professional is crucial. They can guide you in managing side effects and ensuring that your blood pressure is properly controlled while minimizing any negative impacts on your overall well-being. Conclusion. While misconceptions about normal blood pressure ranges exist, it is essential to rely on accurate information and consult with medical professionals for proper diagnosis and treatment. A blood pressure reading below 140/90 mm of mercury is generally considered optimal, and maintaining healthy blood pressure levels is crucial for overall well-being and reducing the risk of cardiovascular complications. While misconceptions about normal blood pressure ranges exist, it is important to rely on accurate information and consult with healthcare professionals for proper diagnosis and treatment. A blood pressure reading below 120/80 mm of mercury is generally considered optimal, and maintaining healthy blood pressure levels is essential for overall well-being and reducing the risk of cardiovascular complications. Thank you for visiting us today. Don't forget to like and subscribe, it really does help our channel grow. Looking forward to seeing you soon for our next video.